When you hear the term gout, what comes to mind? Do images of wealthy, overweight, indulgent men sitting in a recliner with their foot elevated come to mind? It does to me. Even people who are not in the medical profession usually have some idea of what this illness is about. Gout comes from the same Latin root as the French and English words for gusto, gourmet, and gourmand, meaning overindulgent or extremely appetizing. And men, as well as the obese and those who eat large quantities of certain meats, seafood, and alcohol, are indeed at greater risk of developing it. However, what most people may not know is that gout is an inflammatory form of arthritis, also known as crystal-induced arthritis. Each year, gout affects about 4% of the U.S. population, or approximately 8.3 million people. It is more common with age, and the incidence of gout is expected to increase as the population continues to age. This painful condition often begins with a sudden onset when the patient awakens to find a swollen, red, warm, very painful big toe joint. While ankle and Achilles joints can be afflicted as well, the classic presentation is with a swollen, inflamed joint at the base of the big toe. Patients often describe the pain as severe. Gout occurs when an excess of uric acid, a normal byproduct of DNA metabolism, builds up in the body to such a point that crystals form in the synovial joints, which then lead to a cascading immune system response, creating the pain, swelling, and if left untreated, ultimately destruction of cartilage. So what is uric acid, the villain in this story, and why is it building up in the patient? First, uric acid is produced when your body metabolizes purines, substances found naturally in your body, as well as in certain foods like steak, organ meats like liver or kidney, and seafood. Alcoholic beverages contain high amounts of purines as well, especially beer, along with drinks sweetened with fructose. Normally, uric acid dissolves in the blood after digestion and passes through the kidney into your urine for excretion. But sometimes your body either produces too much uric acid or the kidneys excrete too little, as in the case of renal disease. In either case, when uric acid concentrations rise, needle-like crystals begin to form in a joint or surrounding tissue that cause pain, inflammation, and swelling. Patients with high levels of uric acid or hyperuricemia are more prone to develop gout. A blood level greater than 6.8 milligrams per deciliter of blood is considered hyperuricemia. Unfortunately, uric acid levels are no longer a standard test in common blood panels, and pre-gout conditions often go undetected. Certain chronic conditions contribute to a higher risk of gout. These include high blood pressure, obesity, diabetes, metabolic syndrome, heart and kidney disease. In addition, thiazides, a class of medication used to treat hypertension, as well as low-dose aspirin, can contribute to higher uric acid levels. A family history of gout, as well as age or recent surgery or trauma, also place a patient at more risk. Gout is usually treated with non-steroidal anti-inflammatory drugs, such as Advil, Aleve, or in some cases, prescription Indocin. Colchicine is a very effective pain reliever for gout, but has side effects of nausea, vomiting, and diarrhea that some patients find intolerable. Corticosteroids such as prednisone are administered orally and in some cases injected into the joint directly to reduce inflammation and pain. If recurrent gout occurs, patients may be placed on medications that inhibit the production of xanthine oxidase, an enzyme involved in the production of uric acid. Such a medicine would be allopurinol. Medications are the most effective way to treat and prevent gout, but lifestyle changes such as limiting the intake of alcohol and sweet drinks, as well as red meats and some seafoods, will help keep uric acid levels low. Getting your protein from low-fat dairy products seems to provide a protective factor against gout. And of course, regular exercise and losing weight reduces the risk as well.